I would like to welcome you to webinar number 7. I can't believe that we're already up to our 7th webinar of the series. And real quickly, I know many of you, but I'm Jody Waterhouse, and I am with the CU Anschutz Multidisciplinary Center on Aging, and certainly welcome you, like I said, to our 7th webinar of the 9-part series that launched last fall. Unfortunately, my co-host couldn't be here today as she had a clinical session, Dr. Sarah Qualls, but she also sends a warm welcome to all of you today. So a couple just quick housekeeping items to give you a little reminder that we've got 2 more sessions left of this 9-part webinar series, Emotional and Mental Health in Older Adults. Next week, the session will focus on Healthy Brain, Healthy You. And then our final session on February 4th will be Living Well with Dementia. And due to the tremendous response that we have had to this webinar series, and many of you asking for more, we are working on right now as we speak a part 2. So we will roll out a new webinar series later this spring. So make sure to keep an eye on your emails for that announcement. And again, thank you very much for participating in this very important community education opportunity. A reminder that after each session, you receive an email that has an evaluation link in it. If you can take literally 1 minute, it doesn't take more than that, to fill that out for us. Also, one of the questions is about future topics and what it is that you would like to hear. And we want to hear more from you. So if you can take some time and jot those down for us and fill out that evaluation, that would be terrific. I would also like to acknowledge our community partners, Denver Public Library and Broomfield Senior Services, both who are collaborators on this webinar series. So a huge thank you goes out to them. Many of you have also asked about recordings of each of these sessions, and those can be found on our CU Anschutz Multidisciplinary Center on Aging YouTube channel, of which I also include that link in the evaluation link each week. So make sure you're checking back if there's a session that you missed that you wanted to watch. They all are housed there. So without further ado, I'd like to get started with today's presentation. What can you do when you notice memory problems? Our speaker today is Dr. Jessica Zamzo. She is a neuropsychologist at the UC Colorado Springs Aging Center. She has conducted research focused on sleep and cognitive function, and she completed her fellowship in clinical neuropsychology at UCLA back in 2018, and we're thrilled to now have her in Colorado. So with that, I would like to introduce Dr. Zamzo.
Thank you very much, Jody. And hello, everyone. It's a pleasure for me to be talking about the topic of memory today with you. So the title of my talk is What to Do When You Notice Memory Problems. And I want to acknowledge that we have quite a diverse audience today. We have some older adults and service providers, and some of you may be thinking about noticing memory problems for yourself or for loved ones or for people you care for professionally, friends, and so on. So I want you to think about, when I talk about what to do when you notice memory problems, flexibly as far as who that might apply to in your personal experience. I also want to note before I jump in that I talk about memory, that's in the title, and I'll be talking about it throughout the presentation, but that's not the only area of thinking that can change or become problematic. Things like problem solving or word finding, impulsivity, and so on. Those are all things that may change, and they have to do with thinking, and sometimes may be related to memory. So a lot of people who walk into my office noticing a wide range of changes in thinking tend to label them as memory problems, and that's oftentimes how we think of it. But I want you to recognize that when I talk about memory, I may be thinking about it in a more broad way too. And I'm also happy to answer any questions you have at the end of the presentation. You may want to write them down as they come to mind so that you don't forget it at the end. I know I can. Okay. So when it comes to noticing memory problems, Jody mentioned that I work for the Aging Center. And so mostly thinking in the context of working with older adults. And of course, this webinar series is tailored to thinking about older adult topics. So there are expected changes that happen in the brain as we age. Our brain is an organ, and like any other organ, as we get older, there can be some normal wear and tear. Of course, there's variability, things like health and lifestyle factors, genetics, and also how mentally stimulated you've been throughout your lifespan can impact variability in those changes as we age. But to some degree, there is normal wear and tear. And so for older adults, that can affect things like speed of processing, how quickly information comes in and out, how quickly you're thinking. There tends to be a mild decline in memory. So remembering where you placed an item or where you parked the car. And then word finding difficulties. That's that tip of the tongue feeling, you know, I know the name, I know that word, I can't pull it out. So those are the most common changes that occur with aging as we get older. And actually that starts in our 30s. Hard to believe, but we're really at our sharpest in our mid-20s. And then once we get to our 30s, there can be some slight declines that accelerate over time. So some of this talk will be geared towards how do you know when this is just expected, part of the lifespan, versus something to address clinically, speak to a medical provider. And one kind of rule of thumb is to kind of take a look around and understand, are the things that I'm noticing, are the memory changes I'm noticing what my peers are experiencing as well? And you may not know unless you have a conversation about it. You can observe so much, but if you let someone know, you know, I feel like I've been really misplacing my keys a lot, and I bet you'll get some of your peers having the same experiences as you. So that's kind of a good benchmark. Is this similar to what my peers experience? And also normal changes with aging do not typically require outside support. You know, it may be outside support in the form of a reminder, but if you or the person experiencing memory problems is needing someone to take over the task, things like financial management or organizing a pill box, if they're no longer able to do that, that's typically outside of what's expected as we get older. And I'm going to go into more detail about what that looks like, but that's kind of a rough overview. Okay, so this graph kind of illustrates that nicely. I don't know if you can you see my mouse on the screen?
Yes, we can.
Okay, great. So this bar here represents cognitive function, good functioning all the way down to severe impairments. And what we have here is this line demonstrates the trajectory of normal aging and cognitive changes over the lifespan. Let's say this starts around 30 when there may be very subtle changes. And this down below is a representation of the cognitive changes expected with Alzheimer's disease. Alzheimer's disease is not the only cause of memory changes, but it is the most common in adults over 65. And this general trajectory can also be applied to other causes of cognitive impairment, or most other causes. So we'll just use this as an example to kind of really illustrate and visualize what's going on. So if you'll notice with normal aging, the changes start out very slight, again, around your 30s. These aren't going to be perceptible changes until you get further out here. Then you eventually see more of a dip after maybe 70, late 70s, 80s, more of a dip, but still quite different from this graph here representing Alzheimer's disease. There's quite a difference in cognitive ability. So with Alzheimer's disease, you have a period earlier in life where your just matched up just perfectly with your peers. There's no signs or symptoms. And slowly that begins to accelerate. Right in this time frame here, this may be your 40s and 50s. The difference between normal aging and that preclinical, before it's really detectable on our tests, phase of Alzheimer's disease, you're probably not going to notice much. It would be very hard to distinguish just by observing the types of memory problems you may be having, whether that was normal aging or preclinical Alzheimer's. Once that progresses further, and for most people that might be in their late 60s, 70s, but there's a lot of variability on timing of onset of the more clear cognitive or memory difficulties in Alzheimer's. The difference between that mild impairment, MCI, mild cognitive impairment, and the normal aging becomes more apparent. So this is where you're likely to start picking up on more noticeable memory problems that are different from what your peers are experiencing or what other people observe as normal for your peers. And unfortunately with Alzheimer's disease, that trajectory just keeps.
They thought that Trump was going to
that trajectory just continues to accelerate until really the end of life. And so that would be at that dementia phase, there's a quite significant difference between your peers with expected cognitive changes. Okay. I'll just actually add one more thing. Another common cause of cognitive changes or memory problems as people get older, although it can affect you across the lifespan, would be a stroke. And that would be the one clinical cause of memory changes that would look very different from this. In fact, with a stroke being the cause, you're going to have a big gap at first, and then as healing occurs, that gap may narrow. But as far as neurodegenerative diseases like Alzheimer's and other that I will talk about on the next slide, that's what you would expect. Okay, so just a few statistics to sort of wrap our brains around how common this is and what settings this may be seen in. Age is the greatest risk factor for dementia. There are certainly early onset causes of dementia, and brain injury actually being one of the common ones. So dementia is an umbrella term that captures individuals with severe cognitive impairment, something that requires much more support in their daily lives or other people to take over activities. So one type of dementia is Alzheimer's disease, and that is the most common in adults over 65. You can see that accelerates substantially as we age. So in that group of 65 to 74, only 3% of people have a diagnosis of Alzheimer's disease. Once you get to over 80, there's about a third of people in that age group that have that diagnosis. That's a huge difference. So age is the greatest risk factor for dementia and particularly Alzheimer's disease. I've said it multiple times, that's the most common cause of dementia. But next after that would be what we call vascular disease or vascular dementia. And that can be caused by a stroke, a series of mini strokes, or even very small blockages of blood flow to the brain over time. So that may not even be something that you can see and observe, but that if they were to do an MRI of the brain or do some cognitive testing, that would come up on there. But it's not an observable stroke. And then Lewy body dementia. I wonder if some of you may heard of that, but it's the second most common neurodegenerative cause, or the third most common dementia in older adults. The easiest way to think of it is a combination between Parkinson's disease, some aspects of Parkinson's disease, and some aspects of Alzheimer's disease. So it has a physical and motor component like tremors, as well as memory loss and other cognitive changes. And then there's another subset of causes of dementia in older adults that would be the minority, about 5%, and that includes a wide variety of different causes that are somewhat more rare. And then 42% of individuals living in residential care, older adults living in residential care, have been diagnosed with dementia. That does include all levels of care, so assisted living where there's a high level of independence, but most of that, 42%, probably live in nursing care or memory care. Still a large group of people. Okay, so we've talked about some symptoms of normal aging. Let's talk about more about what you would be on the lookout for if you're concerned about something beyond normal aging or memory problems that are beyond normal aging. So one that can be quite noticeable is getting lost in familiar places or maybe en route to familiar places. So it's unlikely for that to be initially seen as getting lost in a friend's home, but maybe on the drive to a friend's home that you visit once a month or so, or that grocery store that you don't go to every week, but should be familiar. You once had no problem finding it, and now you're getting turned around. Repeating stories or questions often without realizing it. And again, this wouldn't necessarily be once a week. You know, you told one person, you forgot you might have told the other, but not being aware that you've told or asked the same question multiple times within a week or even within a day. Increasing falls or loss of balance. Now that's not anything to do with memory or thinking, but because the brain is involved in all of our sensory and motor functions as well, those can be signs that there may be something going on that's beyond normal aging. And if you see that without any other medical explanation, paired with some of these other cognitive changes, that could be something to take notice of. Changes in personality. Those can be quite noticeable. It may be in the form of a really blunted or disconnected approach, or all of a sudden this impulsive and maybe agitated approach to social interaction. So changes in personality is an important one to look out for. And it doesn't occur with all causes of dementia, but it can be noticeable when it happens. Forgetting recent events, that would be even with a reminder. So that would be the types of day-to-day events that would stand out. Not necessarily forgetting what you had for lunch yesterday, that might be something forgettable, but forgetting you went to the dentist last week, or that you visited a friend you don't normally visit. And even if someone tells you, remember we first went out to eat and then we stopped by so-and-so's house, and it still doesn't come back to you, that can be particularly concerning. It can be an earlier sign that there's something beyond normal aging. Repeatedly getting stuck on an activity or topic of conversation, especially if that's kind of unlike the person. I know there's some people that may be part of their personality, but engaged in a topic or activity and everyone kind of wants to move on, and that person is really having trouble disengaging or keeps going back to it. And then another one is difficulty planning or organizing everyday activities. So a task like scheduling a medical appointment may become overwhelming or confusing when it once was not. So that's a long list, and you might even see some overlap between those types of examples and the types of things you might notice with normal aging. Some have to do with changes in memory or processing, but that's because there's a spectrum. Some of the same kinds of things that you would notice in normal aging can occur when there's something more going on, but it tends to be more extreme. And that can make it difficult to tell where to draw the line between, is this expected or is this something more? So we'll talk in a minute about what you can do if you do become concerned about memory for yourself or someone else in your life, and what kinds of resources or methods you can to discriminate that. Okay. So now that we've gotten to this point in the talk, I want to acknowledge that talking about memory loss and dementia can make some people feel anxious or worried. I see it a lot with people who've had a family history of Alzheimer's disease, thinking, could that be me? Should I be worried? So I want to talk about worry about memory for a second. And first say that nobody's memory is perfect. We're just not built that way. And you may know people in your life who just have superb memory, but in general, the way our brains are built, we're not expected to remember everything. That would just be inefficient. So take that and remind yourself that you are going to forget some things. And we'll talk later on about strategies to help support memory and be more likely to remember, but nobody has perfect memory. And worry can interfere with your memory because worry can take your focus away from what it is that you are trying to attend to, think about, and remember. If you're paying attention and trying to monitor, am I going to forget something? Did I just make an error? That's taking up some of your mental bandwidth. It's distracting. As well as oftentimes the emotional reaction that comes when you notice a memory error. You might become frustrated, embarrassed, or anxious, and that really takes up a lot of the emotional centers of your brain, take up a lot of energy and attention. And so less energy and attention can be focused on thinking. As I mentioned, it can be hard to judge what's typical versus atypical. So here are some starting things that you can do if you do become concerned. Take note of times that you forget or what examples are. And you don't have to write everyone down, but anything that strikes you as, that feels like it's more significant than it used to be. Write down a few things that you've noticed. Pay attention when you write it down. Was there any contributing factors like sleep deprivation, or was I really worried about something that was about to happen, or something that has been on your mind? Was I multitasking? Was I watching TV while trying to remember where my keys were, or I put my keys down when I was having a conversation? What kinds of contributing factors might have led to that memory error? Then talk to someone who you trust, who knows you well. Tell them what you've noticed and ask them if they've noticed anything. That can give you an idea of the bigger picture, whether someone's concerned about it or whether they say, it looks like exactly what I experienced. And either way, you should talk to your doctor. If it's something that feels concerning to both you and the other person, you might want to schedule an appointment right away. If it's something that you think might be normal, you can bring it up at your annual visit. And consider bringing someone to that appointment if you're talking about your memory so that they can share their perspective as well. But importantly, I don't want you to wait too long before you address the concern, whether it's for you, a family member, or someone you're working with, providing services to. And we're going to talk about why in just a minute. So at this point, we've talked about things to look for, how to recognize memory problems in yourself or others. Worrying about those problems can be natural, but not necessarily helpful. And I encourage you to talk to your doctor if you do have concerns. So now we're going to talk about why that's important, right? It's important to talk to your doctor. To me, what stands out is the fact that early diagnosis matters.
Anyhow,
How is it?
It looks pretty good. It's mainly.
So early diagnosis matters because early intervention matters. Many interventions are more effective in the earliest stages of memory loss. And having the right supports in place can keep individuals healthier and more independent for longer. So oftentimes people want to avoid acknowledging a memory problem because it feels like maybe nothing can be done. And it's true that in many cases, like Alzheimer's disease, there's no cure, but there are things that can be addressed and maybe modified to keep the person healthier and independent for longer. And for a lot of people, that's key for quality of life. And I also want to acknowledge that caregiver burnout is part of the picture too. Caregiving in these cases tends to be long-term. And so putting supports in place early to reduce burnout can be very important. I'm sure many of you have heard before that mortality and disease are more frequent in people who are caregiving versus those who are not. So getting those supports in place quickly is important. Early diagnosis and intervention also matters because memory medication, if appropriate, is most effective early on. So when the memory problems kind of first set on, you can think about that Alzheimer's disease graph, and kind of flattening that out for a little bit longer can make a world of difference, but it tends to be most effective early on. It's also an opportunity to address treatable contributors that, if ignored or not addressed, can actually exacerbate memory problems long term. So addressing that early can set that person up for optimal brain health and optimal cognitive function. So things like sleep disorders, substance use, or medication effects. If the individual with the memory difficulties is aware of how that may be impacting their thinking now and potentially long term, they can make decisions about whether interventions or modifications is worth taking on. Another helpful reason why early diagnosis and intervention is important is the opportunity for therapy. That could be in the form of cognitive compensatory training, so compensating for or supporting cognitive difficulties, psychotherapy for the individual who may need some or desire some supports in learning how to cope with these changes as they come on, as well as acceptance of that diagnosis. Acceptance are part of the grieving process that people often experience as they lose memory or they are witness a family member losing those functions as well. And then addressing long-standing maladaptive problems, patterns. So that may be things like anxiety or frustration, maybe trauma reactions, things that aren't facilitating quality of life can become more interfering once memory loss continues. So think about somebody who may have difficulty developing trust as a protective mechanism. I mean, that's often seen in individuals who've experienced trauma. Their trust has been broken and their brain, their body is telling them that trusting isn't safe. If that person goes on to need a lot more supports down the road due to memory problems, that trust may be a barrier to accepting care and could set them up for dangerous situations, safety concerns like if they're not accepting someone to come in and provide meal services, they may have poor nutrition, or having an OT come and set bars in their shower, they may be more at risk for a fall. So therapy can address multiple areas that can set someone up for both longevity and better quality of life. And keeping in mind that earlier on, someone's going to experience more benefit of that while learning is more intact, as well as caregiver and family therapy. And I discussed that importance of addressing caregiver needs earlier on in the last slide. I don't want to neglect the idea or the possibility that receiving an early diagnosis can also be an emotional burden for the individual and or the family. It can be a lot to deal with emotionally to recognize what the future might hold. And that's probably at the heart of why a lot of people might avoid telling their doctor. It's important to acknowledge that that can be part of the picture. By putting in some therapy supports, whether it's a counselor, support group, that can mitigate that and allow the individual and their family to potentially grieve. Oftentimes that's what's going on, and do so in a way that keeps them connected and in line with their values. And ignoring the problem doesn't necessarily mean that that burden isn't going to be there. It will probably come up in other ways, like I talked about some of the safety concerns or the burnout or the frustration. So again, avoiding it is not necessarily the best answer. Kind of going along those same lines, detection, I alluded to detection of safety issues, but there's a couple important ones, driving, medication management, nutrition. If you have a diagnosis that you can expect there may be a decline in your level of independence, keeping an eye out for those, particularly those activities of daily living that are important for a healthy and safe self. And really addressing those safety issues can reduce the frequency of preventable hospitalization or neglect. It's those families that, or individuals that come to me through Adult Protective Services for diagnostic evaluation that tend to be much further along. So they kind of got to a point where nobody talked to a doctor, they avoided it, and as a result, the right supports weren't in place, and there may be neglect or hospitalizations or even financial exploitations because those supports weren't attended to. And there's also the important aspect of future planning. So education about what to expect, making decisions, putting things in place, getting them in order, and then making plans that fit with life goals and values. I hear some people talking about wanting to have that big family trip, and they were putting it off maybe for 10 years, but decided let's do it in a year or two because this is important to me and I want to make sure we do it while my memory is still sharp. So here are some more concrete steps that you can take. Talk to your primary care doctor. Let them know that you've been concerned. You may want to do this during, you may want to schedule a specific appointment about this, or just bring it up during your annual wellness visit. I believe Jody sent out a handout about some Q&A about the Medicare annual wellness visits that people don't necessarily think to bring up memory during a physician appointment. But your physicians and your primary care providers are trained to know what to do when that comes up. They may do a short memory test, a screener, like a MOCA or a SLUMS, to get a rough estimate of cognitive ability and help decide, is this something we want to look into more? They may also order some lab work, some blood work or imaging, so an MRI of the brain, or do a sleep study to rule out some of the possibilities, trying to understand what might be going on. And they're likely to also, if there's cause for concern, refer to neurology and neuropsychology. And they may start with one or the other. And together, neurology and neuropsychology can come together to see the full picture of motor and sensory and cognitive functioning in order to help with diagnosis and treatment planning. You can also request a neuropsych evaluation. So your primary care might order it off the bat, or you might advocate that that's what you want. So what is a neuropsych evaluation? So I am a neuropsychologist. This is my bread and butter. I do testing of multiple domains of thinking. So memory, attention, problem solving, all of the above. The neuropsychologist then takes that information and they first compare it to a peer group to understand, is this typical amongst your peers? And we have to use mathematical equations, et cetera, to really get a scientific answer there rather than just a subjective perception. And then in addition to that, neuropsychologists look for patterns in ability, and that helps us differentiate what might be causing the memory problem. Does it look like what we expect with Alzheimer's disease? Or is the cause look more vascular? Or does it look like what I often see with Lewy body? Or is it maybe depression or PTSD? All of those diagnoses look different in subtle and obvious ways. And a neuropsychologist is trained to disentangle that and try and understand what might be on board. The goals are diagnosis and treatment planning. So is this typical aging? Consider other causes. Coming at a diagnosis of Alzheimer's disease, for example. Treatment planning can include a variety of different recommendations. These are just a few that often come up in my practice. Identifying reversible or controllable risk factors. I mentioned sleep on a prior slide, and I'll mention it later on, and that was my area of research focus in graduate school. But sometimes identifying even the possibility of an undiagnosed sleep disorder when there are signs and symptoms that might be at play can be one area where by improving sleep, one can reverse some of the effects on thinking, if not entirely. And so oftentimes, if that's the case, I might refer back to your doctor to talk about a sleep study. Similarly, I may refer back to have you consider some medications or have your physician consider whether medications might be appropriate. Oftentimes that might be medications for memory. Sometimes that might be memory or medications for depression or something along those lines. Teaching compensatory strategies. So by looking at one's pattern of strengths and weaknesses on testing, you can get a more individualized education on how to rely on those strengths in order to support the weaknesses. There may be other therapies that are useful, so psychotherapy, caregiver therapy if a family member is involved or other caregiver, occupational therapy, physical therapy. So these might be recommendations that are generated by working with a neuropsychologist. And then also discussing appropriate supports. So things like in the home or day-to-day supports that may be useful. So that would be the typical approach to that would be a comprehensive evaluation. It can take several appointments, several hours to really get to the bottom of what's going on and provide those recommendations. Some clinicians also do a brief memory checkup, and it will look different at different clinics, but typically the utility of a brief memory checkup would be when their normal aging is suspected, you can establish a baseline that you can compare over 1 or more years. So if you notice some memory problems, but you're pretty sure it's typical, you might go in just to make sure, because it can be hard to find where that line is if you don't have some objective measurement. And then you have a baseline. So if 2, 3 years down the road, you notice that the memory problems have gotten worse, you could go in for another test, whether it's comprehensive or brief, you still have a nice comparison baseline. These are much shorter, as implied by brief, but they still can take some time, 1 to 2 hours. I noted a couple clinics I know in Colorado that provide this as an option, but often wherever you can get a comprehensive evaluation, they may offer a brief evaluation as part of their services. A lot of universities and medical centers have neuropsychologists, and especially any sort of aging focused medical center or mental health center. So that would be one way to look for where to find those evaluations, as well as the more comprehensive evaluations. So now we're going to talk through a few ways of supporting efficient thinking and memory. There's also a handout that Jody sent out. We won't cover all the strategies in these next few minutes that are on the handout, but we'll talk about a few of my favorites, and you can refer back to that if you want more. So I'm going to go back to that idea that nobody's memory is perfect. These strategies are and tips are useful for pretty much anyone. In fact, I use most or all of these myself. And it can be modified when there's more significant impairments. It can be modified and applied to yourself or to others you work with, thinking about how to better support your or other cognitive function. Okay, and these are also good habits to practice, actually, whether or not you're noticing memory problems. If these kinds of approaches to thinking become habitual, if and when you do experience more significant memory changes, you already have this in practice and you're likely to be able to compensate much better for longer. So this is kind of a general guideline to how to reduce distractions, because distractions pull attention away and make it harder for you to think efficiently. So cutting down on multitasking, which we're all getting very used to nowadays with phones and computers and emails and everything going off. Addressing physical sensations that can be distracting, like hunger and pain, sleepiness can really make it hard to focus. We talked about stress and worry pulling your attention away. Low mood, it's a similar idea. This, when you're feeling down and sad, that consumes some of your attention. You're often noticing it. Just like pain, it kind of pulls your attention away here and there, or maybe constantly kind of in the back of your mind. And then feeling under pressure, if you're putting a time deadline on yourself or feeling pressure to get it perfect, that is going to be something that's pulling your attention away as well. So by reducing anything that's pulling your attention away, you can focus, attend, and more likely to remember and think efficiently. This is a nice acronym, PEAS, about how you can better target your attention or actively engage, because remembering information in a conversation, for example, or just in day-to-day life requires to be actively engaged. If your mind is elsewhere, you're not going to remember. A good example I like to bring up with that is when we go into autopilot while driving. Maybe you're driving your familiar route to and from work, for example, and you kind of just forgot how you got there. It just went into autopilot. That's because you're not actively attending. You're able to kind of go through the motions with minimal attention. You can listen to the radio or an audiobook and attend more to those other things while still successfully getting to your destination. That's because your attentional focus wasn't on your route or the things you notice along your route. So P's. Preparation means clearing your mind, addressing your biological needs that may be distracting. Come to set. Energy conservation is about making sure you're well rested, taking breaks, taking care of watching your energy level, because if you're tired and fatigued, you're not going to attend well. Active effort, that's about that active engagement, removing the distractions and intentionally focusing. I think about when I park my car in a parking lot, especially a place that I go to often. Pull in, park, maybe I'm listening to something on my headphones, go to the store, come out, and I have no idea where I parked. Like maybe I kind of remember it was on this side of the lot, but if you're not actively attending, your brain's not going to think that it's important to remember, and it's in one ear, out the other. So make a practice of saying, you know, when I park, I know I'm going to need to remember where my car is. So I'm going to look around, I'm going to think about markers, and I'm going to maybe even write it down on a piece of paper if it's hard to focus. But active effort is important. And then self-talk. So that a good example of that is that experience when you walk into a room and you cannot remember why you went in. I think it happens to all of us. And the reason behind that is because when you're heading to the room, let's say you're going to the kitchen to take out the trash, you only need to remember that information until you get the trash in your hand. Your brain knows that. It's going to be only on board temporarily. You don't want to remember that tomorrow. That's just going to take up too much space. So it's in a type of memory that's like our memory sketch pad. It's going to get wiped as soon as you don't need it, which is in 10, 15 seconds. You can only hold so much on that mental sketch bag. It's limited. So if you get distracted at all, that memory sketch pad is wiped clean. So you're on your way to the kitchen to get the trash and you notice, oh, I forgot to start the load of laundry, or, oh, I need to remember to pack my lunch later. Mental sketch pad is wiped clean. And that's not necessarily a problem. It's how your system's built. So what I do, especially if I'm distracted, if I'm thinking of a lot of things or I have a lot on my mind, I will practice self-talk, and I will be in the bedroom and I'll think, oh, I need to take out the garbage. So as I walk to the kitchen, I'm going to sort of say to myself, taking out the garbage, 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 and you're reciting it so that nothing else can kind of pop in and distract you and take it away from your mental sketch pad. So those are some great attentional strategies that can also help with memory and thinking efficiently in general. As you can tell, many of which I use. So another good practice is mindfulness. Right? It's becoming more popular. So some of you may have heard of mindfulness as a practice. I don't have time to go into it in much detail. I just go over some key points and then encourage you to, if it interests you, to look up more information on it at a later time. And I have some resources, resources down here where you might find some more information, but really any bookstore, Google has tons of information on mindfulness. It's becoming popular. So this is the practice of becoming aware in the present moment. So bringing your attention, focus to the present moment. It's been shown by research to improve attention even when you're not practicing it. So if you routinely practice mindfulness, different exercises, it's going to exercise that memory muscle, and it's going to have positive effects downstream in improving your memory, because if you're attending, your brain knows this is important, I should remember it. It's a great group activity to do a mindfulness practice. So if you do work in a senior center or you live in a senior center or a residence, this might be an idea you bring to consider practicing in a group if and when group activities are going on. So again, if you're interested, look up mindful walking, mindful eating, mindful breathing exercises. You can find audio guided exercises. So lots available out there. Okay, just a couple more slides on compensatory strategies and some more great techniques. Establishing routines or habits can really aid memory. So this picture here, you can actually buy this on Etsy, but I picked one with a little bit of a Colorado theme since that's where I'm at. We've got the mountains, but we have a great example of a home for important items. You've got your wallet, glasses, key, you might even hang your mask on there. And if you put it right there, as soon as you walk in the door, I promise, as long as no one's stealing anything, it'll be there when you leave. So for those of you who I never put my keys down in the same place, I don't know where it is, my glasses end up who knows where, establish a home. And you got to think creative to get practical, because maybe you do need to wear your glasses in the home, but you put it on your nightstand as soon as you're done. It always goes back to the same place. And I promise you, when I put my glasses down somewhere other than the couple places that I've identified, I'm going to be looking for them later. Routines are also good for checking your calendar. And if you need to learn a new routine or establish a new routine, attach it to an old one or one that you already have. So taking medications when you brush your teeth or with your morning coffee, if that's already a routine, helps that habit form more quickly. Taking a walk after dinner, if you're trying to create a new physical activity routine, if you're eating dinner every night, especially if it's at the same time, taking a walk after or maybe before is a good way to set a routine. Or if you have an alarm that is on repeat for many days, that can be the way to start a habit. And then after 20 days or so, you might not need the alarm. It's just part of your routine. So a few other miscellaneous strategies that help work with how our memory works. Repetition is important. Our brain works through overlearning. So in school, that might be writing notes. So you're hearing it and writing it. That might be using flashcards to study or reciting the information. And even though that's something that we think of mostly with studying in school, you can use those same strategies for remembering information in everyday life. If it's a name you want to remember that's important to you, or something your doctor told you to do, taking notes is one form of repetition, and then go back and read it later. You can visualize or tell yourself a story, so that you might hear something and you picture it in your mind and kind of elaborate on it. That really helps encode the information. So that has to do with getting the information in. And then if you have trouble pulling it out, you might want to use cues or reminders. So looking back on notes or photos, thinking about something related. So maybe you can't remember the name of that friend, but you know their brother's name, that might trigger it for you. And using alarms and reminders are cues as well. And I like this little, this might have been on Etsy too, I'm not sure. This little doormat that says phone, wallet, keys, mask. So you head out the door, you look down, oh, I need to go back and get one of those things. That's a reminder or a cue. So I'm gonna wrap up. I'm not gonna go through these resources in detail because you all have a handout that includes these, and some of them are specific to Colorado, but there are some neuropsychology clinics where you can get access to the testing services, diagnosis, maybe other mental health care like we have at the Aging Center in Colorado Springs. There's also a study going on at UCCS with cognitive compensatory training, and it is virtual. So anyone in Colorado could participate. There are some inclusion requirements, but if you're interested, you would call this number. It's on your compensatory handout as well as the resource handout to get more individualized cognitive training using compensatory strategies. I don't want to neglect any caregivers. So important. These resources are on that handout. The Alzheimer's Association website is great, especially for people who are not in Colorado to find resources that may be local to you. Then that could be for both caregivers and individuals looking for memory diagnosis or treatment. There's a book on that list that is very helpful for caregivers as far as education and understanding supports. So excellent resources that I hope some of you can take advantage of. And in these last few minutes, I am available to answer any questions.
Thank you so much, Dr. Zanzo. That was terrific. Lots of good strategies, and between the PowerPoint and the handouts that you all received, you've got some excellent resources. I do know that on this call we have, or on this Zoom, excuse me, that we do have a number of folks who are outside of Colorado. So I would like to extend, certainly, if you do have questions about resources in your areas, to call any of us on that resource document that Dr. Zanzo has shared with you, and we can help point you in the right direction. All of these clinics have colleagues across the country who are doing similar work. So use us as a resource, and don't think that you don't necessarily have something in your community, because you probably do. And we're probably working with them. So Dr. Zanzo, just a couple great questions. Do you know of any research around the effects of menopause on memory, both temporary and or permanent? This particular attendee says it seems to be fairly common in her peer group.
Definitely something that anecdotally is, like you said, with your peer group, you may be talking about. And there is some research on it. It tends to be a temporary phenomenon, maybe brain fog or just not thinking as clearly with hormonal fluctuations. And our hormones are tied to our thinking and our sleep and all other aspects of our physiology that can disrupt thinking for some. It's not ubiquitous, but it is a common experience that people report and should resolve when menopause resolves. Though with the timing of when that occurs, people also tend to start noticing cognitive changes just associated with normal aging or maybe something else. So hard to disentangle, but something that's commonly reported.
Terrific, thank you. And then another question is, can dementia be diagnosed when a TBI is a known factor?
Yes. So I'll answer that in two ways. Because I mentioned earlier, dementia is an umbrella term. You could technically be diagnosed with dementia due to a TBI. So that's one way that it might look. We also know that multiple concussions or head injuries of different levels of severity can increase risk for cognitive decline later in life. It can increase risk for Alzheimer's disease and other forms of cognitive decline, or it may exacerbate normal aging. So whereas it wasn't really a problem before, but you've had dozens of concussions, you might notice that your thinking is not quite at the level of your peers. So a neuropsychological evaluation can help disentangle some of those factors. How much of this is related to the brain injury? Is there something more going on? And in those more complicated scenarios, it may require testing over, you have your baseline assessment and can kind of disentangle pieces of it, but they may recommend follow-up in 6 to 18 months to see where things are at and get a more solid sense of all the pieces involved.
Terrific, thank you. And do supplements like Prevagen work?
There isn't a lot of research evidence backing up the current supplements on the market. There is a lot of research on more dietary modifications, like the Mediterranean diet, anti-inflammatory diets, and things to not include in your diet, like excessive alcohol, for example. So thinking about like nutrition and vitamin supplementation, if you don't have a deficiency, for the most part, it's not necessary to take a supplement. There is a lot out on the market that isn't research backed and isn't regulated by the FDA. If you want to find more information on specific supplements and the research or lack thereof, the Alzheimer's Association has typically some of the most up-to-date information on that. You can go to alz.org and type in the specific supplement. If it's more obscure, it may not be on there, but some of the popular ones, they'll have some information on where the research is at. But in general, there's limited research.
And there's a question about cost. So in some of these tests that you referred to in your resources today in the presentation, are those covered by insurance, or how do people pay for those types of tests?
Great question. So if there's a medical need, so if there's a question of whether there's dementia or another medical condition on board, that will be covered by most insurances. If it's more of that brief evaluation where there's no reason that you or your doctors are really concerned that there's something medical going on, those typically are out of pocket. Some of them are funded by research studies, so it's going to depend on the clinic. For example, at our clinic, we have a reduced fee scale, so it's quite affordable to get that brief assessment done. And then we take Medicare, which a lot of clinics do, for the more comprehensive evaluations. You don't necessarily need a doctor's referral. It's going to be insurance dependent and clinic dependent, but oftentimes you can give your local neuropsychologist a call, let them know what you're concerned about, and they can help determine whether there's a medical necessity that could be billed by insurance.
Great. And with regards to medications, are there some that do cause short or even long-term memory loss?
Definitely. There's quite a few out there, so I'm not going to go through listing all of them, but benzodiazepines are the ones that I see most often that are most severely affecting memory. Those are often prescribed for sleep or anxiety. However, there are a lot of other medications that can have varying degrees of impact on memory. So, if you read the side effects of your medication bottle, if it has an effect, it probably will say memory loss on there. But there's also sometimes interactions between medications that could be on board to exacerbate a memory weakness. So talking to your doctor, again, if you're concerned about memory changes, that's going to be the best place to get information about, should I be concerned about this being part of a side effect of a medication? Do we want to consider reducing the number of medications, that sort of thing?
Okay. And Cynthia brought up a great point that, especially for your caregiver section, when you were talking about resources for them, that the Alzheimer's Association now has support groups that are done completely virtual. Due to COVID, they've moved all of their sessions virtually, so that can help folks obviously not need to travel to a local support group. So thank you for that, Cynthia. We really appreciate that. And then another question, we just have, I think, time for 2 more. Have you ever heard of chemotherapy versus cancer causing permanent memory problems or a loss or a memory loss of some sort?
Yeah, so chemotherapy quite consistently causes temporary brain fog, difficulty with attention and memory, but there can be more persistent effects. Not for everyone, but it can happen. And that's usually seen more like efficiency and quickness of thinking is is most affected. But I do encourage anyone who's, 6 months or a year out of treatment and still feeling like they're not as sharp as they were before to go in and get that evaluation. There may be other factors contributing, like maybe changes in sleep or health that also occurred with chemotherapy. Or this may be something that's more lasting, but identifying that and troubleshooting ways of helping support that is helpful. With cancer, primarily, certainly with a brain cancer, if it's another type of cancer that's been fully treated, it's less likely to, but your brain is an organ and it relies on your other organ systems to be efficient. So if liver or kidney is affected or heart in any way, that can have downstream effects on thinking. So each individual situation is specific, but can be a good reason to come in for an evaluation and kind of understand what's going on and what might be modified to help thinking.
Terrific. And it's 3 o'clock, but we have 2 more questions. So for those that can stay on for 2 more minutes, we'll get these answered. Thank you very much, but they're really great questions and I'd love to have you, Dr. Zamzo, just address these. We had someone ask about a plant-based diet helping with memory. Can you comment on that?
Yeah, so I'll go back to the Mediterranean diet, which is the most researched, or the DASH diet, which is very similar if you've heard of that one. And those diets, for one, starting kind of in middle age and going over time, but really starting at any point, reduces your risk for any cardiovascular problems, which in turn helps brain health. That's one of the most important aspects. I talked about other organs in your body, but one of the most important for your brain is your heart. Mediterranean DASH diets focus more so on vegetables and fruits, but allow for some other meat sources. Fatty fish like salmon are actually quite good for your heart and your brain in moderation, and reducing red meat intake as well, although in those diets it's not necessary to eliminate them. So a vegetarian diet fits nicely with that. I don't think that there's tends to be no health negatives for that, but if you're looking for something that includes maybe some more variety, the Mediterranean or the DASH diet has been researched time and time again to show reduced risk of decline in the future.
Terrific. And last question, it's around dehydration. So dehydration can be a cause of confusion, but is it also a cause of cognitive decline, or is it more of a temporary issue?
Great question. And I didn't really have time to get into some of those like easily reversible causes, like an infection or dehydration are some of the common ones. With dehydration, it's a temporary onset of confusion just related to your body needing to get back to that homeostasis to be hydrated. However, people with an underlying memory loss, Alzheimer's disease, or other dementia are going to be more susceptible to the effects of dehydration causing confusion. So it's not that dehydration would cause permanent effects. If you were hospitalized for it and it was a very serious medical event, that's another story. But in general, it's going to be temporary and resolve with rehydration, but it may be revealing something under the surface that made you vulnerable to experiencing a big change with dehydration.
Terrific. Oh, thank you so much. And thanks to all of you who stayed on, 3 minutes after we were supposed to wrap up, but those questions were too good to ignore. So we wanted to get to those. And for everyone that's still with us, just a reminder that next week's talk will be Healthy Brain, Healthy You. These last 3 sessions are really dedicated to the brain. So I hope that your schedule will allow you to join us next Thursday at 2 p.m. Mountain Time. Also a reminder, you're going to get a follow-up email right after this session that'll include the evaluation as well as the link to the YouTube channel. That is where we are housing all of the recordings of these sessions. So if you've missed a few or you want to rewatch some of them, please visit the YouTube channel and they are there for you to watch. So With that, I'd like to wish everyone a great rest of the afternoon. Dr. Zamzo, you have a ton of thank yous, great presentation, comments in the box. So a big thank you to you for sharing your expertise with us today. And we look forward to seeing everyone next Thursday. Thank you and have a great day.